So residency is about to start. Let's make sure that you get the most out of those first few weeks and months of residency. We'll get into it in this video. What is up, guys? Zach here with Dr. Eyeball ND. It is good to have you back. If you're new to the channel, I'm a second-year ophthalmology resident, and on this channel we talk about everything from getting into med school, being in med school, getting into residency and ophthalmology residency fellowships, that kind of thing. So if you're interested in any of that stuff, hit the like button, subscribe to the channel, and we have more content coming out all the time. So what I want to go over in today's video are 5 tips and 5 things for you to focus on in the first few weeks, first few months starting your residency, so that you can actually make the most of it. And it's just better to do these things from the beginning. They will make your experience better, they'll make your learning better, and it's something that I wish I had started from the very beginning of residency, that I didn't really kind of pick up on the fact that I needed to do some of these until later on in the first year of residency. So I'll tailor this more toward ophthalmology because that's what I do, but a few of these tips are going to be applicable to really any residency that you are starting. If you do end up finding any of these tips helpful, let me know down in the comments below, and let me know what kind of videos you might want to kind of help you on your journey through medicine and that kind of thing, and I'd be happy to make those videos. All right, so tip number 1 for making your residency experience the best it can be from the very beginning, because it's going to be very stressful. It's going to be a very steep learning curve, especially in ophthalmology, just because it's such a different specialty from anything that you've done up to this point. And really, you haven't learned much of it probably in medical school, so very steep learning curve. So the first tip that I have for you is to just pick one thing a day to actually learn. Now, when I first say this, you're probably thinking that, well, there's probably a lot more that I need to learn than just one thing a day if I'm gonna get good at this fast enough. And you're right, you will pick up on a lot of other things. You are gonna be learning a lot of things just by what you're doing. But what I'm saying is just to pick one topic to actually specifically focus on per day and actually commit that to memory and actually learn it. So as you're going through your day, just be on the lookout for one patient, one case that is something that actually piques your interest more than the other things, something that's a little out of the ordinary. Just make a note of it on your phone for the one thing for the day. And that way, when you go home, you'll specifically focus on that one thing to study about. Now, in addition to just your kind of general studying that you may be doing early in the first few weeks, months of residency, just kind of broad studying, if you can add in this one thing per day, you'll find that it really adds up over time, it really accumulates. If you can learn 365 genuinely new things over the course of a year, you're gonna be amazed at how far ahead you get. And while it doesn't seem like a lot to just really learn one thing a day, it actually does add up. So to give you an example, one way I would apply this is to say that you saw an interesting patient who maybe had, let's say, ocular syphilis. And that's not something that's very common, it's something that's pretty interesting. You jot it down in your phone, you send yourself a text message, this is what I'm gonna go over tonight. And so in addition to your broad studying that you do, just kind of dive into ocular syphilis. Learn the etiology, learn who gets it, learn how to diagnose it, learn the treatment, and just commit those things to memory. It's easy to kind of get lost in trying to learn so much so fast all at once that you don't really learn things well. So if you'll just pick one thing per day, one disease entity, one kind of specific thing to focus on, doesn't have to be a disease, commit it to your memory in a way that you could actually teach it to somebody, you'll be amazed at how far along you're gonna get. So that's tip number 1. So focus on truly learning and actually understanding one concept per day. Tip number 2 is to keep a running list of interesting patients. So when you see that patient come in with something that's not common, something you don't see much, or even if it is common, and you're just wondering how the kind of natural process of the disease is gonna play out, make a list for yourself in whatever EMR you use, whether it be Epic or whatever, make an interesting patients list. And if you see that interesting patient, pull them over into that list so that you can go and check on that patient, months from now, even, a year from now, and see kind of how the disease progressed, how we treated it. That way you can kind of follow up on the natural course of disease and kind of get an idea of how things play out over time, because a lot of times in residency, you're probably not going to be seeing the same patient necessarily and having that continuity that you would if you were like a private practice attending or something like that, just because you're constantly switching off rotations and things. So if you see that interesting patient, you see something that you wonder how this is gonna kind of develop over time and just the natural course of things, put them in the interesting patient category. And you can even divide up that interesting patient list by subspecialty or by category. You have a retina, glaucoma, things like that, infectious processes. Just divide it up that way and pull those interesting patients in so that you can follow it up. It will actually help you learn how diseases progress and whether or not the treatment that we do worked and that kind of thing. Because a lot of times patients get lost in the continuity. Tip number 3, and this one should be obvious, but it's to be nice to the upper levels. Now, it can be a tendency for new residents to show that they actually know a lot or that they know what they're doing to try to kind of impress the upper levels. But if you will take a stance of humility and willingness to learn and listen and not try to kind of show that you know more than you do, they will be a lot more willing to teach you and a lot more willing to help you. So if you want advice from somebody who has done something for years more than you have, be humble, be willing to accept their advice and their critique on things. Tip number 4, kind of in the same vein of learning one new thing per day, one new concept, is to focus on one exam skill per week. Now, kind of getting a good exam in ophthalmology is really the whole basis of being able to diagnose something and then being able to treat it, which is based off the diagnosis. So you have to be good at the exam, and you're going to be going through the whole exam right from the beginning and doing it in a stepwise fashion, and we can go over that in another video. But what I'm saying here when I say focus on one skill per week is to pick one specific part of the exam and really focus on doing that part well. So as you progress through, the first few months of residency, you're gonna need to do, like in ophthalmology, you're gonna need to do things like gonioscopy. So try to do gonioscopy on at least one patient a day, even if they don't necessarily need a gonioscopic exam, if they are okay with you doing it. Because it's a pretty benign thing to do during the exam, make sure that you practice it on one patient a day, every day for a week at least. And you will be amazed at how fast you get much better at that exam. And you can do the same thing with scleral depression. Really focus on trying to get better at just one part of the exam per week. You can't really get excellent at everything right away. It's a tendency that we have just because you're going to be a perfectionist and want to get really good at everything right away, but just focus on one thing per week, get really good at that thing, and over the course of a couple months, you will be really happy with how far your exam skills have come if you do that. All right, number 5, and this is kind of a game that I started playing as I got further into residency, but I think it's something that's good to do if you will start with it right from the beginning. And this applies to ophthalmology specifically, and it's something that I do, which is Guess The Acuity. So our tendency when we get a new patient is to first look at the visual acuity as kind of just the very first thing we look at on the exam. But what I would say is maybe bring the patient in, do their actual exam, look at their history, look at their eye, look at their retina, and look at any imaging and that kind of thing that you have, and then say, all right, what do I think this person's vision should be based off of what I just saw? And in the beginning, you're not gonna be able to guess very accurately probably, but as you go on and you do your exam and then you check and see what the acuity is, you'll start to correlate what a given exam looks like with what the acuity is. And the importance of that is when you get a patient down the line who comes in with certain findings, certain pathology in their eye, you should be able to say, well, this is what an eye that looks like this should be seeing. And if it's not, then it prompts you to go look for other potential diagnoses that might be contributing to visual acuity that doesn't make sense. So that's tip number 5, a game that I like to play, Guess the Acuity. Do the exam, guess the acuity, then look and see how close you were. And over time, you'll start to develop a good sense of what an eye that looks a certain way should be seen. Guys, these are 5 tips that I think I would have liked to have implemented earlier as a starting resident, and that I think will kind of propel you along in your exam, in your learning, and help you basically just get better at it at a quicker rate and help you kind of and these are things that I just kind of wish I had done sooner. I hope you found that helpful. If you did, leave a like on the video, subscribe to the channel, let me know down in the comments what you guys want to know, what you want to learn, and I'm happy to talk about it. I'm Zach with Dr. Eyeball MD. I'll see you guys in the next video.